Johnny, baby, what's the matter? Come on, baby, sit down. What's wrong? Johnny, son, what's the matter? What's wrong? Come on, sit down and eat and we'll talk. Come on, you can tell Grandma what's the matter.
What do you think? I hate you and I hate this place! Grandma, make him stop!
911, I need help. My grandson is out of control.
Being angry is one thing. Becoming a danger to yourself or others is another. There's a difference between being upset and out of control. There can also be a distinction between criminal activity and mentally ill behavior. Today, we want to explore those distinctions. We also want to provide you with some tools and make you aware of options so you can effectively handle incidents involving troubled youth.
If they start to act out and we don't intervene and get the kid the help that they need, what will happen is that they will act out further and in more dangerous ways.
Well, oftentimes when we encounter children who are brought in by the Chicago Police Department, one of the things that we have offered is treatment as an alternative to incarceration.
We need to look a little further, and we need to understand that children who are acting out are maybe having difficulty in intersocial relationships with other individuals, and there may be manifest signs of symptoms of mental illness present. And we need to look and take that step further to get the kid help rather than looking to arrest.
Was he acting out because his mom had just died, or if he just had a bad report from school, or that he's part of a domestic violence situation, or he's actually depressed and don't know how to verbalize his feelings of frustration?
We're not asking our police officers to be social workers out there, and while some people may think that this is a touchy-feely type of approach to the situation, it really enhances the safety of the individual in crisis as well as the police officers themselves.
Let's return to our opening scenario to more fully illustrate how to handle cases involving youth with mental illness. Police respond to the grandmother's call, and when they arrive, the young man, Johnny, is still agitated, angry, and emotional.
You want to talk to me and tell me what's going on?
When you're handling a call that may involve a mental illness component, you're looking for the signs and symptoms that may indicate that there's mental illness present. And if a person is in crisis during a mental illness, you have to approach the situation in such a manner as not to escalate the situation.
Dear, the reason that my partner and I are here today is because we're worried about you. Can you tell me what's happening with you today?
One of the things, if you do have to do, you can use firm, non-threatening approach to get the child's attention. Listen, I'm concerned for you now. I'm on your side. Let's find out what's going on. With the approach, then comes the intervention. I realize that you're upset. I realize there's some things that's been affecting you and been going on with you. I want to get you some help. We're concerned for you.
You want to make sure that it's not your actions and your activity that's causing the situation to escalate, where force then becomes the only option.
All children want to feel one thing. They want to feel safe. Once you create an atmosphere where he feels safe, they generally will trust. And once you feel trust, that's the direction that you want to work in.
In addition to de-escalating the scene and gaining the trust, officers should look for contributing circumstances.
There may be domestic violence presence, single-parent households. There may be adults in the households that are using substances. There can be problems in regards to neglect and abuse. And you have to be mindful of these kinds of situations.
I don't know what to do with him. He's out of control. He needs help.
In this particular scenario, this child's mother had recently died. The 16-year-old is affected by it more physically aggressively, and he doesn't know how to deal with his frustration. No one had offered him any kind of counseling for his grief loss. There was no process where he had be in a position where he can articulate his feelings of depression, frustration, and anger.
In our scenario, the officers bring Johnny to Hartgrove Hospital, one of the Chicago Police Department approved facilities to treat youth for mental illness.
One of the first things we do a confidential assessment. All the confidential assessments that we do here with our children, as well as adults, are free.
What brought you here today? Well, my mother died about a month ago, and as a result, I kind of acted out.
When they come in, they are given us an assessment. They are determined what level of care that they may need. Some of them may need the DAYS program, which is a program that's designed for children who aren't necessarily a threat to self and others, but may have some behavior issues that they need to address that they are not exhibiting in a structured environmental setting, when they need a more concentrated environment, therapeutic environment. In our day program, they're picked up in the morning, brought to the facility. They get both individual, group therapy, and counseling.
Johnny, let's talk a little bit about the incident with you throwing the vase against the wall.
Well, I was really mad. I felt like I was going to explode or something.
When inpatients are a different thing.
Yeah, I got real
Oftentimes, inpatient, they have to be a legitimate threat to self and others. And when they're part of the inpatient, again, they get their individual group counseling therapy here. Initially, when they come in, they have to write an autobiography about themselves. That way we get a better feel about what's going on with them, both in community, at home, and in school, and in their whole holistic environment. At that point, they then go through various treatment programs that are designed specifically for that child. Number one diagnosis that kids that come in here is oppositional defiant behavior. The second major diagnosis is major depression. And so we design a program specifically for that child and the issues that he brings.
In our scenario, Johnny and his younger brother get plenty of help. Issues at home, issues that were tearing the family apart are resolved.
One of the things where we have to also look at, when you treat a child, you must also treat the family. One of the things that we do, we have the family come in for a family session. What Johnny has to look at, that he's not in this alone. We will be supportive to him. We will be supportive with setting him up with outpatient assistance. We'll be supportive with having grandmother know that she can also call should Johnny start to act out again.
Under certain circumstances, it is best for a young man or woman, best for the family, and best for all concerned when we can identify, approach, and intervene to get our troubled youth the help they need. You are an important first step in getting them that help.
We have found that these children are able to be worked with. They're able to ventilate their feelings of frustration. We have found that children, when they come here, they can be kids again.
If police officers don't step forward, there really is no one else in society that has the opportunity to intervene at a very early stage and get children the help that they need. Whether we like it or not, it's become our function as police officers.
If you need additional information concerning your role in getting youth into the mental health system, call Research and Development at 745-6071 and ask for the Crisis Intervention Team Coordinator. Thanks for your attention, and as always, stay safe.
Remember, this type of diversion is not an option when serious criminal activity has occurred. When evidence of a serious criminal act is present, arrest is the proper procedure.